I generally tell patients, make sure you're taking a probiotic that has multiple different species in it, right? Our gut microbiome should have a very large amount of different species.
What about the impact of natural antimicrobials on the healthy microbiome of the gut and the vagina? Is that a potential issue?
Yes, that is definitely a potential issue. The longer that you use some of the more potent antimicrobial herbs, the more that this is a potential to happen, not necessarily for the vaginal area, but definitely for the gut. So we do know golden seal at a higher dose for a longer period of time, we're talking numerous months, can start to disrupt the levels of healthy flora in the gut. But, and same with oregano oil. Oregano oil is another one that can do it. I don't use oregano oil with many, if any, patients because it is an extremely potent herbal product, and it is one of the most likely to disrupt the healthy bacteria. But that might be a trade-off, right? If that is working for a patient versus taking an antibiotic, which we know is going to have a much bigger impact on their biome, then maybe that is the lesser of two evils. So, you know, it's not, decisions need to be made with a practitioner about the therapies that you're choosing and whether to do them long-term, short-term. An educated practitioner is going to be able to help you determine how best to continue treatment.
Right. When it comes to prevention, you've mentioned a few kind of broad spectrum antimicrobials. Is there something that people can be taking longer term once they are well to help prevent something happening again in the future?
Well, I do really like some of the cranberry products. There's really good research for the 36 milligrams of proanthocyanidins. So I definitely use that for prevention because it's very safe. It's even safe for pregnant women. We do know that the PACs are anti-adherent to multiple different bacteria. D-mannose is also very good, but we do know it's fairly specific to just E. coli. And again, D-mannose needs to be taken at the right amount, number of times a day in order to be reliable. So there isn't necessarily, I mean, cranberry is maybe potentially almost like a herb, right? It's more on the food side of herb spectrum than something more potent. In terms of preventing future infections, a lot of the lifestyle behaviors are one of the most impactful factors that we can help counsel patients on. So water intake, they're getting enough water every day from a good quality water source is very well researched to help prevent urinary tract infections. We're keeping our stress down. I know way too many patients that have the same story of I was very stressed out and then I got a really bad UTI, right? So learning better ways to manage stress and potentially rooting that stress out of our lives in order to prevent it from happening in the future.
What about specifically for people who experience UTIs after sex? Is there something natural that could be used as a prophylactic there?
So the herbals that are used to treat an active infection could be used in the same way as a prophylactic antibiotic. Taking the 36 milligrams PACs is another good strategy. If you know that you have recurrent E. coli infections, taking additional D-mannose. D-mannose is extremely safe. It's a sugar that doesn't spike our own blood sugar. Taking a probiotic is another important way to continue. So after intercourse, we tend to use a oral probiotic, not necessarily standalone though. If a patient is having infections after they have intercourse every single time, then we would potentially step that up and do a vaginal probiotic as well. But even in patients who are occasionally getting an infection after intercourse, yes, a probiotic around that time is helpful, but it wouldn't necessarily be enough to prevent an infection, unless it also was one of those probiotics that had the cranberry extract with a certain amount of PACs standardized to it.
Okay. Do you use compounded probiotic pessaries, or is this something that's available on the market?
Yeah, there's numerous products that are available on the market. I'm always looking for ones that have L. crispatus. There is some research that's coming out that's indicating that women who have healthier levels of L. crispatus are generally have fewer lower urinary tract symptoms. So this is new. So not a lot of the vaginal probiotics products have this yet, but hopefully more are coming.
When it comes to gut health and UTIs, are there particular strains that you recommend there?
Well, we know that those particular lactobacilli strains that are important for our bladder and our vaginal health, they travel from the gut over to these areas. We don't 100% know the mechanism by which that happens. So making sure that the gut does have robust lactobacilli levels and a good diversity of lactobacilli is important to help promote the health of those other two biomes.
Okay. Is there a certain CFU or how many billions of probiotics that people should be aiming for?
Well, again, this is an individualized approach. It would depend on whether they've used multiple antibiotics, what types of antibiotics they've used. We know that the biome recovers much more quickly after, say, a round of amoxicillin versus, say, a round of Cipro. Huge differences there. So it's going to depend on that patient's history. If a patient comes in and they've had lots of antibiotics, then it's usually a higher dosage, 50 billion potentially even starting, and then potentially a lot more depending on how recent that antibiotic use was. And if someone is relatively symptom free, but they're just looking to prevent, they can go with a lower billion. We don't necessarily have research to tell us exactly how many billion to be using. It's more about the different species that we're using. That is where more of the research lies, with the exception of something like Saccharomyces boulardii. We do have some more research that suggests what the dosage that is appropriate for that. So make sure that I generally tell patients, make sure you're taking a probiotic that has multiple different species in it, right? Our gut microbiome should have a very large amount of different species. I think some estimates are saying 1,500 different species of bacteria. So if you have a choice between a probiotic that has 2 or 3 strains versus a probiotic that has 10 to 15 different strains, that one is probably going to be better for your gut health versus the actual amount, the billions amount. So that's more of what patients should be potentially looking for general health, for the health of their digestive system. So I just want to add some additional information about probiotics. Some of the research that's coming out is showing that we may only get benefit from probiotics as we are taking them. When we stop taking them, we're not necessarily getting the benefit from them necessarily changing our flora. We're definitely lacking research in that area, though, because that's just in healthy individuals. That's not necessarily in individuals with specific conditions. But what some of the research is showing is that what promotes a healthy, diverse gut microbiome is people who eat lots of different types of vegetables, not someone who's just eating cucumbers and peppers and carrots, and that's premium, that's not diversity, right? There are hundreds of different types of vegetables out there, and eating different ones is going to potentially introduce different bacteria into your system. Another way is obviously the probiotic foods, right? They're going to help enrich our different microbes in our gut, depending on that, depending on what that particular probiotic food, how it's made, right? Kombucha has many different bacteria and yeast species versus something like sauerkraut, which is more of a lactobacilli, right? but then also where we buy our food is important. There's actually research that shows buying food from a farmer's market is more likely to support a more diverse biome in our gut than buying supermarket foods, because there's going to be more trace dirt and, and maybe not so many chemicals that are on the farmer's market produce. So all those things are potentially better at changing our gut microbiome for the better long term.
Okay, that's good to know. That kind of takes us into diet, but I wanted to quickly talk about C. diff, because a lot of patients that have been on long-term antibiotics have an issue with this. Is there an approach that you use when it comes to that?
When it comes to C. diff, because it is such a life-threatening condition, it's very important to work with your medical doctor and take the prescribed antibiotics. There are some adjuvants that some people take alongside to help eradicate the infection. So there are berberine products that may have some activity against C. diff and make the antibiotics more successful. Saccharomyces boulardii is a yeast that is able to help patients when they do have a bout of C. diff or prevent C. diff. However, it is not a standalone treatment for C. diff at all.
If it can help prevent it, does that mean it might be helpful for people who have a tendency towards C. diff to take it when they're on antibiotic treatment?
Yes, that is the general approach. If a patient has a past medical history with C. diff, it would, anytime they take an antibiotic, it would potentially be wise to have that addition in there.
How is the gut microbiome related to frequent UTIs?
So we do sometimes see that those bacteria that are in the gut are potentially traveling to the urinary tract and causing the infection. The exact mechanisms of that are not 100% understood yet. We suspect, because of that shorter difference between the anus and the vaginal canal and bladder and urethra, that the bacteria are able to migrate across the perineum. However, that I don't believe is very well understood still. However, we do tend to see that those bacteria that potentially are colonized in the gut can cause infections. So one of the mechanisms could be the inflammation that those particular microbes are setting up, right? If we have bad bacteria in the gut, that inflammation may have a systemic impact on the body, and that may filter down to patients' bladder potentially. So we do need to make sure that the gut is healthy in order to reduce inflammation in general. A lot of people talk about SIBO, and that is definitely something that can create more inflammation and leaky gut and issues in the digestive tract. So there isn't research right now to suggest that it is helpful for UTI. However, we do have a small study that shows it's useful for IC patients. And of course, we also suspect that many IC patients are just undiagnosed chronic UTI patients. So there very well may be a link there, and it would make sense if there's other types of chronic inflammation that can predispose patients to more bladder infections. Why not another condition that creates inflammation in the gut, right? Like SIBO.
Yeah, that makes sense.
Or yeast, right? And that's a lot of, that's another one that is very important for the patient population to be looking at with their naturopathic doctor or other practitioners, functional medicine doctors. That way, because of the antibiotic use, that is probably one of the most common outcomes is a yeast overgrowth in the gut.
Right. Yeah, we do hear a lot of that from our community. When it comes to diet in general, do you think there is a role of coffee, alcohol, and sugar in recurrent UTI?
Definitely. And this is one of the facets I talk with patients about the most. There are definitely foods that trigger more inflammation in the urinary tract. Coffee is easily the most well-known. Probably second would be alcohol, and sugar. Sugar is a bacteria's best friend, right? So most bacteria, not all of them, of course, and yeast. So food definitely is something that if you start with an infection, it's not necessarily going to treat it, but by having a good diet and minimizing those particular foods that you know that you're sensitive to, you're able to reduce the frequency of UTIs for sure.
Okay.
A lot of my patients, or not a lot, sorry, a number of my patients, their chronic UTI started after they had 5 coffees a day and forgot to even take 1 sip of water, and they were going through stress at the same time. Minimizing those things, keeping them at a healthy level, is usually tolerable for most patients. So it's not necessarily about completely avoiding. Some patients do, for sure. There's that small subset that cannot tolerate any, but a lot of the time it's just not about overdoing it.
Right. And are there certain vitamins that we should take more of or avoid if chronic UTI is an issue?
Yes. So I, in particular, see the B vitamins, certain ones, not all of them, B2, B5, B6 are potential irritants. Potassium is a potential irritant. So depending on someone's multivitamin, or maybe they're taking a B complex and they are trying to do something good for their body, but unfortunately, because of maybe the chronic inflammation that is present in their bladder, they're triggering even more. These things seem to also irritate the bladder wall, and then that can predispose towards more infections, unfortunately, or just in general, more symptoms. If you're a chronic UTI patient, then creating more inflammation in the bladder at any time is going to potentially create a bit of a flare, right?
Yeah.
Vitamins that people should be taking more of, that's again an individualized approach. However, making sure that your vitamin D levels are optimized is very important. And I know lots of other practitioners have talked about that on here with you guys. So I do, not as a blanket statement, should everyone be taking more of it, because you can develop too high of levels and it can have bad outcomes. But testing your level and then taking an appropriate dosage to help make sure you're in an optimal level is important for vitamin D.
Okay, a number of people report that they get irritation from taking like a supplement version of vitamin D, especially in capsules or oil-based capsules. Is there another way that you can gain enough vitamin D to make a difference that is not that?
Well, we can't necessarily spend all kinds of time in the sun, right? So there is the possibility of them looking into D2 supplements and hoping that their body can convert enough of it to D3. Those patients that are reacting to it, they're going to want to look at we call them excipients, which are the other types of products in that particular supplement. So we do see that from time to time, that people aren't actually alert or aren't having a problem with the D itself. They're having a problem with another ingredient, coconut or some other excipient. D3 does come from sheep lanolin, so you do have to make sure that patients don't have a wool allergy.
Okay.
That could potentially be what's going on for some patients. Anytime you trigger an allergic response in the body, there is the possibility of making bladder conditions worse, right? We see some patients actually using antihistamines in order to reduce their symptoms. So that could be what's happening for them.
Okay, interesting. Do you think it's possible to target biofilms with treatment? And are there any methods that you use to do this?
So biofilms are, again, a very new area of research. So we don't necessarily have research that says a particular biofilm disruptor is definitely going to treat a biofilm in the bladder. However, as an adjuvant to the antimicrobial therapy, if we suspect there's a biofilm, I do think it's worth adding in order to help break down that potential biofilm. So biofilm disruptors do need to be selected based on the patient's history of their chronic condition. Certain biofilm disruptors are stronger, some are weaker. So it depends on how long the patient has had symptoms for in order to select the right ones. I often see patients coming to me on biofilm products, but unfortunately they're not likely to have been making a huge impact, because the biofilm, as it matures, it becomes more organized and harder to break down. So that needs certain products in order to do that.
And when you say products, are these the kind of thing that are sold as biofilm disruptors, or do you use certain herbs that might have that kind of action?
I use certain products that are marketed that way.
Okay.
The advanced phase 2 biofilm disruptor was formulated by Dr. Paul Anderson. That's probably one of the ones, I think your community does know about that one. And it is a very, very good one for a more advanced biofilm. However, some patients don't tolerate it. The sulfur compounds in it sometimes irritate some patients. So there is also IV therapies that are used. I'm less knowledgeable in that area. That's something for an IV certified practitioner to potentially talk about.
Okay.
But yeah, there are herbs that are weak biofilm disruptors. The more we research into whether or not a herb has that quality, the more we're finding. So even juniper it has biofilm disrupting qualities. Black cumin seed does. So it keeps growing. What we're finding out is able to disrupt a biofilm. Yeah, and I mean, some of the antibiotics disrupt biofilms as well. So it's becoming a facet that people are really, really paying attention to, and I hope we get more research as time goes on.
You mentioned the transience or potential transience of probiotic usage. Do you think it's possible to actually return to a healthy microbiome once you have had frequent antibiotic use?
Yeah, I definitely think it is possible. Like I had mentioned earlier, there is research that shows that it does take time, but usually the microbiome does return to a state of health. I think one of the most important predisposing factors is your overall diet, long term. So if you've spent years and years and years on antibiotics and eating poorly and things like that, it's going to take that much longer for it to recover. But that's part of what I do as a naturopath, right? We believe in the body's innate ability to heal, and those bacteria are a foundational aspect to our health. So we definitely feel that as a profession, we believe that can heal, and that diversity can come back. We just need to put the right plan in motion, the right foundation and healthy lifestyle going forward.